Hamilton's hospital unions are warning tonight of a significant threat to healthcare in the city. They say conditions are already bad for patients.
And in at least one of the city's major hospitals, things could get a lot worse. Al Sweeney is covering this story and joins us live tonight from St. Joseph's Hospital in downtown Hamilton. Al.
Emily, the CUPE unions representing hospital workers say this hospital is a scary place to be following years of government cutbacks. Now they say the provincial government is holding back money the hospital needs, and patients are going to be feeling the pain. The focus today was St. Joseph's Healthcare, as 70 or 80 hospital workers and supporters rallied outside. They're fighting a decision by Premier Doug Ford's government to hold the hospital's increase in funding this year to 2%. They say 2% doesn't keep up with costs and will mean layoffs.
2% is not helping the system as it is standing now because, I mean, the rising cost of medical supplies, bandages, and bedding, everything's gone up.
It's just going to make it worse. There's going to be more beds in the hallways. There's going to be more patients waiting and dying, waiting for treatment, whether it is ER treatment, whether it is in the OR being canceled. It's terrifying.
The unions say cutbacks have already taken a toll on workers and patient care.
The workloads keep increasing. The burnout is at an all-time high.
When we have increased workloads, higher nursing to patient ratios, this creates a dangerous situation for our patients. How do we care for our patients when we're eliminating positions? We should be expanding.
St. Joseph's Healthcare said in a statement it's facing difficult but necessary decisions that will mean eliminating a total of 62 positions, but says they will not reduce access to services or impact our ability to deliver exceptional care. A spokesperson for Health Minister Sylvia Jones says the province is putting a record $91.5 billion into healthcare this year and ensuring all hospitals have the resources and support they need.
Layoffs don't make healthcare more efficient, they make it dangerous. When healthcare workers are laid off, patients pay the price.
People who work in the hospital are concerned.
It's already bad now, people waiting hours and waiting in hallways, and I can't even imagine how worse it's going to get.
Pretty terrible, to be honest with you, so with the cuts coming, I can only imagine how bad it's going to be.
Shame on Doug Ford!
With Hamilton politicians lining up with the protesters.
Could it get any crueler? How in this province, the province that is as rich as this in Ontario, are we cutting beds to provide care to newborn babies, to preemies?
And we have to start saying the quiet part out loud, which is that this government is starving our public system so that they can quietly ramp up privatization and say, well, there was nothing else that we could do.
People are waiting in the ER for 10, 12, 24 hours for care. The last thing that should be happening is cuts. If people are dying, waiting for health care.
So the demonstration here today was one of a series that CUPE is holding across the province to call for more hospital funding. They say the hospitals need a funding increase of 6%, not 2%, just to stay level with where they are now.